Hey, welcome to Managing Mental Health While Returning to Work, the COVID-19 Library Directors. My name is Marvin Gorski, and I'm here with my colleagues, Renee Folson-Logan and Emily Zellner, Linda Hollander, and of course we have the backup technology wonder of Eric from BCCLS to help us out. Today, we're going to, a couple of housekeeping issues. In our presentation, you're going to see a chat box that we can use for anyone who has any technical issues, any quick kind of comments or questions. But if you really have a major question about any of the content, or you want to see us bring up an issue that is near and dear to your heart, you certainly want to use the Q&A. And we'll be monitoring both the question and answer and the chat as we go forth. And we'll be able to hopefully make sure everyone's concerns, questions get answered. Last week, in case you do not know, we did present a version of this, a little slightly different, to the staff, the library staff. And of course, we have been, and that went well. And of course, during the week and during the last couple of months, as a mental health agency, we've been dealing with an anxious public, dealing with returning of work issues. So we're very familiar with this issue, and we know that today, especially in light of the governor's recent order to open up libraries, at least partially as of July 2nd, we hope that we can at least touch upon some of the concerns and that you'll be able to get 1 or 2 points out of this presentation. So here we go.
Okay, and so we wanted to start out by just sort of getting a lay of the land for today, and what are our learning goals? What do we want to cover? And I want to remind everybody and invite everybody as we go through the content, if there's questions that come up or if there's things that you want to be absolutely sure that we address and cover, just put it in the question and answer box, and we will be monitoring that, and we will either, sometimes we might answer a question within the presentation, and sometimes we have sort of scheduled this so that we want to leave some time at the very end for a little bit more discussion. So please do that, as the question comes to you, don't be shy. So today we want to go over some tips for creating a safe and less stressful and effective work environment for not only for yourself, but for your staff, and of course for your patrons. We want to talk about how are we adjusting to a changed workplace now, and also the new dynamics that may arise among staff, because everybody, although we're all in this together, people may be responding very differently to the coronavirus pandemic, to the different restrictions, to the reopening. Everybody is may have a different perspective. So how do you navigate that? How are we going to use mindfulness and other coping skills to manage our own fear and anxiety, anger and uncertainty, because all of us are going through our own responses and our own feelings. And then we're also going to go over a few different communication skills and tips to de-escalate any conflicts, conflict resolution, and how do you implement the workplace protocol in an effective and low-stress way. And start out with mental health.
So it makes sense in this presentation, we're going to start with focusing on your mental health, because your mental health is going to be first and foremost in how you're going to go about your job as a director to communicate, to kind of implement all of the kind of rules and new changes that are going to go on. So we just wanted to sort of take a second and sort of say, wait a second, let's look, because when you talk about your own mental health, you're talking about everyone being in a different place, different levels of anxiety, of stress, of concerns. It's all on a continuum. And we wanted to know that basically just that is an important part, that we have to just take stock for a second. Okay, where's my head at? How comfortable am I? And that's something that we want to just just take for a second and maybe in a couple of slides, kind of take a little bit of look at that, because that's going to be a key piece to how we go forward.
So there's what they call areas or domains of well-being, and as you can see here, they encompass social, creative, physical, material, intellectual, emotional, nature, and spiritual. And like Marvin said, one of the first things we're going to focus on is your mental health.
So the images that you see in this slide and the next were taken from a workshop that we did where participants were asked, what does stress look like to you? And you'll see lots of different feelings about what stress looks like, especially in the body, a racing heart, racing mind, what if, little thought bubbles above the head, tears. We'll see a lot of physiological gastrointestinal dysfunction, headaches, dizziness, fainting. You get the picture, that stress and trauma, anxiety are experienced in the body. And that is something that we know, but we also know that different modalities like mindfulness can be very helpful in alleviating stress.
It's really important that you recognize the level of stress that you're at. You just got an increase in stress when you heard about the governor's pretty quick kind of instant decision to open libraries. So realizing that that's already thinking about that is going to release stress hormones, adrenaline, it's going to raise your blood pressure, it's going to raise your heart rate. And if you don't pay attention to that, if you just, you don't listen to your body in terms, you're going to wind up with physical aches. So it's important to know that you may be more prone to have headaches and backaches and sleep disorders and other kind of self-destructive behaviors. And that's even before you heard about the governor kind of saying it. That's just a general sense of dealing with, in your responsibility, just dealing with COVID-19, period, on a personal level. Now you have that additional responsibility. So just basically paying attention to the physical and psychological kind of things that are going to happen. And if you don't pay attention to this, what happens to stress if it's left, unmanaged in the body? And that's what happens. It causes depression and anxiety, and those are very common. And so it's not unusual to see this. And if you yourself is okay, then the next thing, of course, you might see it in your staff. But right now we're still focusing on you having that awareness, that just being aware of your own energy and sleeping patterns and eating patterns. Because all of these emotions of anger and fear and worry, they're always in the background, and we just got a little bit of an extra boost knowing that that time frame is now coming. So it's something just to be aware of and to manage.
Right. And so, everybody has a certain degree of strength and resilience within them. You've gone through different challenges in the past and you've been able to cope and to overcome. But, it doesn't mean that everybody, we're all human beings. And so it's very important to keep, paying attention to your own sense of well-being and understand when it's good to ask for help. And of course, we're the Mental Health Association. We always say, hey, we're in this together. What's wrong with reaching out for help? It certainly doesn't hurt. So if you feel that you're not operating at your best, or if you notice some of the signs and symptoms, like you're not sleeping well, you're anxious, you can't concentrate, you're more irritable, more reactive, you may want to ask for some extra support. We say this and we emphasize this because we know how hard it can be for people, especially for directors and managers who are in that position of responsibility and looking out for others and taking charge. It can be extra hard for people in that responsible position to admit, like, hey, I need a little help for myself too. Things like embarrassment, the family culture that you may have been raised in, gender expectations can all be obstacles in picking up that phone or, reaching out to someone for help. We know that when people are suffering from depression, for example, it can often take people up to 10 years before they pick up the phone and really get connected to therapy or other mental health resources. And we all know that if you were to break your leg and you waited 10 years to get, medical treatment, you'd end up with a leg that doesn't function. So we want to treat our mental health with just as much respect as we would treat our physical body.
So, as Renee said, if you need help, you need to know what type of help is available and where you might go for help. So some treatments that are effective are talk therapy, medication, changes in our lifestyle, supportive therapies, and nutrition. Engage in your natural support system, which can be family, friends, your pastor. Right now, most people are doing online meditation groups. If you go online, there's lots of apps that you can download for meditation. I know a lot of temples, churches, and other places of worship are doing also online things for their congregants. And then, of course, reach out to people in the healthcare profession, such as your primary care physician. They know you well, so reach out to them through telemedicine if you can't get in to see them. Your employee assistance program, and you could also have a safety plan. And here we have the information for the Mental Health Association. Feel free to give us a call if you find that you are in need of some help.
So, one of the things that's been so difficult over this period and continues to be difficult is that there's a lot that's unpredictable and a lot of things that are really big things that are beyond our control. And I'm sure if you take a look at this slide, you'll recognize, imagine a lot of these things will resonate, especially as we look at reopening and going back to work. The idea of what if others don't follow rules of social distancing, or how do I cannot control the actions of others, or predicting what will happen, other people's motives, how long this will last. These are all things that are beyond our control. But if we can, shift our thinking and focus more on the things that are within our control, and I think this is especially helpful now with returning to work, what can I control? In addition to my attitude, I can also think about the things that I'm doing to take care of my safety, following CDC guidelines, doing what I need to do to take care of myself. So basically, we want to try to, shift away from the focus on the things that are beyond our control and focus more on what is within our domain.
So some of the current concerns that we've been hearing and that we're aware of is certainly how can I protect my own personal health and safety as I do my best to follow the guidelines? How can I create a workplace environment where staff feel emotionally and physically safe? Well, what if staff doesn't follow the guidelines? Well, what if there are disagreements among staff? These are questions. What if patrons don't follow guidelines? And what communication tools can I implement to sort of engage cooperation and certainly prevent de-escalation of conflicts, no matter who's involved with that? And with so many unknown factors, how can I manage my own discomfort? So it's just some of those kind of questions we hope to address.
So, where do we start with all this unpredictability? And as Marvin said way back in the beginning, we start with ourselves. So manage your own anxiety and your own stress levels as a starting point. And we know that no matter what we're doing, no matter what we're engaging in, if you start from a place of feeling grounded and anchored, you're going to perform better, you're going to feel better. And this is a place where we want to ask participants to use the chat function, if you feel comfortable, to identify, what has worked for you in the past when you've been under stress, and also how would you describe your own strengths? So I want to remind everybody that even though this presentation is being recorded, the names of the attendees, none of that is being recorded. So you can feel free to, if you'd like, in the chat section, could you write down something that describes your own strengths? And just some ideas, like someone mentioned last week, I never give up. I'm very persistent. Any other things that people want to say? I'm not seeing too much activity in the chat function. Maybe our panelists have something that they want to put in the chat. Like, what are your strengths? Emily, Linda, and Marvin, you got anything that you want to identify? I have, oh, here we go in the Q&A, adaptability. Adaptability is an amazing strength. It's like a superpower right now because there's so many changes. When there's a lot of changes, you need that agility to adapt. Here's a few other examples of strengths: being resilient, being a good communicator. Anybody have a sense of humor? Have you been able to joke about some of the things that you've been experiencing? Your directors and managers, maybe the ability to step back and see the bigger picture of what's going on, seeing the strengths in other people that you're working with. Here's something else. Let's see. Okay, empathy and kindness. Those are very big strengths, especially right now when everybody's going through trauma and some people are experiencing loss and things like that. Having empathy is great. Being calm, having a vision of the future, and then ways to nourish yourself, spending time alone and going for walks in the woods. These are all wonderful, wonderful strengths. Another Q&A. When I start to feel anxiety, I will it away by reminding myself of what I've been through in the past. That's wonderful. Yeah, reminding yourself things that have worked for you in the past. And you can continue to put things there. We're gonna keep moving along. The final point is engaging in self-care practices, which some people have said, they like to go for a walk, maybe stepping outside and getting some sunshine, practicing good sleep hygiene, meaning winding down before you go to bed at night, engaging in your support system, engaging in your spiritual practice or your religious practice, and all of those types of things. That's great.
So, we know that living through a pandemic certainly, can create preconditions for trauma, especially being quarantined for all this time, which most of us are not accustomed to living. No one was really accustomed to living this way. And so these are some of the issues that, that may have a negative impact, that are these preconditions for trauma. And then after this, we're going to talk about what some of the things that we can do to kind of combat these difficulties. So a lack of predictability. We're certainly living in a time where we haven't been able to predict anything. Nothing has felt predictable. There's a lot that's unknown and that lot that's frightening. There's immobility. We're not used to being so confined, staying in our homes, not able to move around. There's a loss of connection. As humans, we're used to engaging with other people, and now we're having to rely more on, engaging remotely or from a distance. Numbing out and spacing out. Sometimes when we're really overwhelmed, we tend to kind of numb out, either by, just sort of distancing ourselves or using substances, and that happens as a result of too much stimulus and too much trauma. A loss of sense of time and sequences. There's been, I think a lot of people have, you'll hear them say, oh, it's like Groundhog Day, every day I wake up and it's just like the last. There is this sense that time is lost during now, and things are very, unpredictable. A loss of a sense of safety. Certainly on a very large level, we have a virus that, has compromised our sense of safety. And a loss of sense of purpose. For a lot of people, we may become disconnected from our greater sense of purpose during this time. Certainly some people haven't been working or, maybe, doing something different than they had been before, and have become disconnected from that sense of purpose. So we know that self-awareness, that everyone is going through stress, and that we can take certain actions to, combat these. And we're going to address that in the next slide.
So some of the things we can think about as practical tips for overcoming unpredictability is managing a schedule. Before the pandemic, we would get up, we would go to work or go to the gym, but we had a schedule which gave us also a sense of purpose. So now that's kind of changed and you've needed to create a new schedule for your day. Some of the other things we talk about is exercise, being outside, enjoying this really nice summer weather that we're having, practice yoga, maybe taking up Tai Chi, Qigong. Deep breathing is one thing which we're going to talk about as we move forward. Everyone is using technology to socialize remotely, but one of the things we can do with families or friends is eat meals together, play games, talk, sing, just find other ways to engage at a distance in person. Use mindfulness and self-compassion to prevent your numbing out and regulate your exposure to stressful news. Some people talk about consuming too much news or too little news. You really have to find that balance in your life and identify conditions that promote a sense of safety.
So this is the clear commonality here is that uncertainty, and there's so much uncertainty. What can we do? And so much of this is sometimes trusting the process. I remember the first time that I had to go to ShopRite in the very beginning of the pandemic, and how anxious I was. And I basically said, okay, at some point, I'm going to will myself. I'm going to put on a mask. And I'm going to venture forth into this new world. And as anxious as I was, I had to basically have some sort of faith that I'll be okay. I'll be able to buy food. And sure enough, it was okay. And then the second time was easier, and the third time is easier. Now it's regular thing. So it's like opening up your doors might even have that same thing. What's it going to be on whenever you open up the doors to the library? How is it going to work? How are the procedures going to be implemented? There's so many questions, and in a way, at some point, you're just going to open the door, and we're going to trust the process that their rules are in place and that things are going to happen. It's having a sense of faith is really what we're talking about here, that we can get through any and all of this.
So now we want to talk a little bit about mindfulness, because we found that that's one of the evidence-based tools that can really be used effectively, and it's very user-friendly and very accessible, and can help us all navigate through these times. So what is mindfulness? It's been described as bringing the mind back home, fostering peace, diffusing negativity, with a goal of being at ease in one's own skin. Some of the core principles of mindfulness-based practices include being present-centeredness, intentionality, non-judgment, and acceptance of reality. And we're going to talk about each of those qualities in a moment. And we just want to mention that mindfulness has its roots in Buddhist meditation practices and ancient cultures. And some of the material we shared today is really, we're drawing upon resources from mindfulness-based stress reduction, which is a practice that was popularized by John Kabat-Zinn. He was, I believe, a molecular biologist who really took some of these Eastern practices, put it into a science-based format that could be more easily researched. And we know that mindfulness has been used for things like chronic pain, cancer patients. It's used in treatment for depression and anxiety, and it can be taught across the lifespan from small preschool children to octogenarians and nonagenarians alike. So it's very user-friendly.
Okay, so the first concept, present-centeredness. It's really about using your senses to experience what is happening now. So it's about being rooted in the here and now, staying present in the moment, giving space to spontaneous insights, because sometimes when we're not in the moment, we may miss those things that are happening right now. Paying attention and focusing on direct experience. And I think that this concept, you know, I think we can all relate to how hard it has probably been to be present-centered now. We're all looking towards the future, thinking, when is this going to be over? If only I can get through this. You know, I was talking to my daughter last night, and she was saying, you know, I just don't think I'm going to feel better at all until this is all over. And I said, you know, I really understand that feeling, but it might be a while before it's over, and we can't just wait till we get there. So we can be hopeful, like Marvin was saying, and hopeful and optimistic about getting through this, because we will get through this, but we also have to be here now.
So Emily, I want to interject and give a shout out to someone who put in the chat. They said that walking the dog helps them de-stress because their dogs live in the moment. So I just want to give a shout out to the animals in our lives to help us kind of reorient to that present-centeredness.
Yeah, that's great. So intentionality, that's the second concept that we have, and it's not just relaxation. So a lot of the times we think meditation, mindfulness, it's just get ourselves relaxed. But we really have to set an intention to find a way to be mindful. You know, if we are meditating, we have to make space and time for that. And I think also in going back to work and in, you know, again, you know, dealing with the reopening of things, we really have to be intentional about what we're doing. You know, what is it going to be like when I go into work, and how do I set an intention to be mindful there and to create the kind of experience that I want for myself and for my staff. So I think we can really see how this, you know, relates to that, that experience, and cultivating awareness, which we've been talking so much about today, the awareness for ourselves, you know, and for others. And then the last concept, non-judgment, the idea that no thoughts are suppressed or criticized or pushed away. You know, oftentimes we tend to judge our thoughts. We talk about, you know, this is a good thought or a bad thought, but the idea of non-judgment is really related to, you know, not doing that, not judging our thoughts, and accepting a thought or a feeling simply for what it is. Observation, not judgment. Studies also suggest that this aspect of mindfulness promotes the development of empathy, so which is the ability to understand and share the feelings, thoughts, and attitudes of another. So, you know, that if we can be aware and accepting of our own thoughts and kind of put ourselves in the situation of what someone else may be feeling, this is going to promote empathy as well.
Yes, and all of these things really encourage us to slow down, and which is kind of the opposite and the counterintuitive to that fight or flight mode. So if part of the antidote is taking time to slow down and practice these things, it can be really restorative to your nervous system.
One might not realize the neuroscience behind mindfulness, that mindfulness meditation does cause changes in the structure and function of some regions of the brain. And these regions are involved with the regulation of emotion, self-awareness, and attention. Mindful meditation also affects our brain activity, and this practice leads to decreased activation of the amygdala, and the amygdala is associated with our fear and stress responses, and an increased activation of the prefrontal cognitive portion of the brain.
Nice. So the effects of taking a single deep breath. So your breath is your body's built-in stress reliever, which is great news because, you know, it's something that we can do anywhere, anytime. And deep breathing has many health benefits, much the way mindfulness does. Simply by doing some deep breathing, whether that's just for a minute a day or taking 5-10 minutes, we can reduce the production of the cortisol hormone that our body releases when we're stressed. We can lower our blood pressure and heart rate, improve our immunity, which we're all thinking about now. Similarly, stimulating the lymphatic system. And also deep breathing even improves our posture. You have to sit up a little bit straighter when you're engaging in some deep breathing. So, so many great health benefits that we wanted to invite you just to take a moment right now to participate in a simple breathing exercise. So wherever you are, I assume most people are sitting, but even if you're standing, just make yourself comfortable, and you can close your eyes or just soften your gaze and direct your awareness to your breath. Just breathe gently and naturally and follow the rhythm of your own breath. If you can, try to breathe in through your nose and out through your mouth. And as you breathe out, you may even make just an audible sound, just letting out all that breath. Breathing out or sighing like that actually sends a signal to our parasympathetic nervous system that it's okay just to relax. And as you breathe in, you may feel your stomach and your lungs expanding. And as you breathe out, just let it all go. As you breathe in, you may feel your body getting fuller. And as you breathe out, just let go of any tension or stress. Breathing in, feeling more alive and awake and energized. And as you breathe out, feeling relaxed and calm. And on your final breath, lengthen the breath, breathing in deeply and slowly letting it go.
So we hope that you're now feeling just a little more refreshed, and we want to revisit some of the concerns about, how to adapt to return to the workplace. So we're going to start out with a few tips to adjusting for change, and we really feel one of the primary ones, and again, a place to start, is really reconnecting with your sense of meaning and purpose. We know that trauma, and we've all experienced trauma through these months of the coronavirus. It's a time, it can be a prime moment to revisit your sense of meaning, because trauma disrupts your sense of meaning and purpose. So we wanted to invite people to think about, to sort of revisit some of the satisfying aspects of your role at work and actively engage in them. So this is the time when we're inviting you to use your imagination and your memory and recall a time that perhaps you've helped a patron, supported a coworker, maybe mediated a conflict between staff, celebrated a work milestone like a promotion or a new position, and really just felt that inner satisfaction from a job well done. We want to invite you to kind of savor those moments and even make a list of, as a concrete reminder of what motivates you. As an art therapist, I'm all about documenting things, and so sometimes I might invite people to make a collage that reminds you of a certain time or that represents certain values that you hold, or something about your strengths, and that can be a very concrete reminder that helps support you as you go through this process.
So as a fact, most of us dislike change. We're creatures of habit. But change sometimes has some positive stuff to it. There's a positive side, because change is an inevitable part of life. And as we learn new skills, as we cope with the change, as we've been doing all along, we actually have to give ourselves some credit. We actually learn different coping skills. how to deal with more anxiety and stress, as we've been looking at this afternoon. And of course, all this makes us stronger, or another word, it does build resilience, which is a very helpful trait to have. So, creating a safe, less stressful, and effective work environment. Well, that's your appointed job here. And we kind of try to put up some of those things. What does it mean? How do you create this? Well, we start off with physical safety in terms of, that means that everybody that walks into the library needs to feel protected from COVID-19. They need to have a sense of that. There's an emotional safety factor. It means addressing the fear and anxiety that's going to happen both in your workplace and certainly possibly with patrons that are going to be coming into the library. So as a library director, you're going to need to have a sort of a clear re-entry plan, which I'm sure you do already. And there's going to have to be informed safety protocols that are going to be in place and resources to help employees with their emotional readjustment of transitioning back to work. And, you know, we have here at the Mental Health Association, we also have been going through this process. We do not have our marching orders to open up our building yet to see people, but we certainly have worked on infrastructure and work on plans and having basically a response plan and preparing our environment and preparing our staff and preparing our visitors, much like you have done, should be doing, and will continue to modify this based on your experience. So basically, the return to work plan, in this case, it could include information, obviously, about maintaining safe distances. We can see that in all of the stores around. Wearing masks, obviously frequent hand washing, regular cleaning of all surfaces. These are major concerns of everybody who comes into the library. The library should already have in place policies that are for sick employees when they can return to work if they're feeling symptomatic. For those of us who feel sick at work, what are the, sort of what's the protocol, which should be in place already. And certainly even taking temperatures and an elevated temperature upon arrival means that maybe you need to kind of consult a medical professional, et cetera. Now, I was just telling Eric and Allison earlier that, we actually have, the Mental Health Association just invested in these temperature kiosks, these things that for every visitor that walks into the building, they're going to walk up to this big giant iPad that's about 6 feet tall, and it's going to read your temperature, and it's going to read out the temperature so that you can then proceed from there. So and that's expensive. Now, I don't know if it's worth it. We'll see we don't know how it's really going to be employed, so we're going to see how it is in different locations and see if that is going to make a difference and stuff. All staff here I get an email every day from an automatic email from our CEO, and says, "Dear staff, can you take your temperature today, and if it's above 100.4, I think it is, please do not come to work and consult your medical professional and seek guidance." So already there's things that are in place, and of course, to be even before you even come to the workplace, and that's important. And these are policies, obviously, on federal guidelines, on CDC guidelines, on state guidelines, local guidelines, assuming that there even are specific, clear, unambiguous guidelines that are really regulating. Because, you can always find things that are a little bit not clear, or sometimes people are left with to fend for themselves. And they can always look at other parts, other agencies, other libraries across the country as to what exactly are they doing that's working, that's in place here. But at the end of the day, it's all about creating this kind of safe environment for everybody.
So particularly as managers and directors, managers need to create a culture of transparency and ensure that there's a healthy up and down communication. So the more communication, the more accessible you are, better your staff will be feeling. So some ways to approach this, maybe you have more frequent team meetings. Or maybe like, what we've been doing is if you create a health or environmental or an infection control committee that's made up of staff, if there are staff who are involved, it can instill a sense of empowerment. And that committee then is responsible to help disseminate the information to all the staff. These may be things that you're already doing. We wanted to kind of go over some of the things that our agency is doing as well. It's important for managers to be physically visible and to be accessible. If you can be open to having those difficult questions and conversations that, may not be comfortable, but if the staff understand that you're approachable and that you're willing to hear their concerns, you already instill a sense of trust and safety. So, you may not have the immediate answer, but the important thing is that staff knows that you're listening and that you're open. And, knowing that you're there alongside them, not sitting behind, a screen and unapproachable. And as managers, it's really important to be aware of and have a finger on the pulse of staff anxiety. What are they thinking about? What questions do they have? And how is the morale with your staff? And so sort of queuing up to the next slide, I want to ask people if you feel comfortable to use the chat. I want to remind you about the Q&A section. If questions come up, please feel free to use. And if you could, take a minute, can you imagine, are there any questions that you might anticipate that your staff may have coming up into next week? What questions do you anticipate your staff having? Or are there questions that you've already received from your staff that you feel comfortable just popping into that chat right there? I'll take 1 second to see if that chat will light up, but maybe not. No. Okay. And here's what we came up with, some of the questions. What do you think your staff might be thinking and feeling? So here's some of the questions. See if they match up questions that you've heard or that you might anticipate. So how often will cleaning be done, and who's going to be doing that? Are staff going to be responsible to clean their own area, or is there a special crew that comes through certain times of day? Will there be plenty of disinfectant available? Are there going to be wipes readily available or dispensers for hand sanitizers? Will there be gloves for staff to wear? Will staff be given masks? Do they have to bring their own masks to work? Will there be controlled office space density and specific staff schedules that ensure that? How will the library monitor building patron density? Is there someone at the door who then says, oh, we're full, you need to wait? I know that many parks have been implementing that. Grocery stores sometimes are implementing that. What are the changes to the normal way that we're going to be doing things? And here's a question in the chat, what do we do if someone won't wear a mask? Yeah, that's a great question. How will patrons access materials, computers, the reference desk, etc.? And how often are these areas going to be disinfected? Some places are like every 15 minutes, someone has to go through and wipe things down. What about changes with specific areas like the break room or the lunchroom? Can people still use the refrigerator, and what will that look like? Will there be individually plastic wrapped spoons, forks, and knives? Are cups going to be plastic wrapped? I think here at MHA we'll have individual utensils that are wrapped that people can use. Can we have is there a water cooler that works without touching? Is there a foot pedal garbage lid opener? And again, will all employees be given masks? And then, what should we do if someone doesn't wear a mask? So these are some of the questions that we'll be anticipating. So I'm not going to ignore that question. We'll come back to those questions.
One of the things that we keep talking about is change, and change in the workplace, change in our personal lives. And we refer to, again, invest time in preparation. So think about your morning routine before you come into work and incorporate practices that reinforce your own sense of well-being and safety. And some of these things could be to review your calendar ahead of time so you know where you need to be, what time you need to be there, what you need to bring with you. You might want to pack a lunch for yourself at this point. You might want to bring your own water. You might want to bring your own supplies, such as hand sanitizer. You might want to bring your own mask. Now, the library might be supplying these things for you, but to give yourself a sense of comfort and to make sure that you're protecting yourself, you might want to bring some of these things as well. The biggest thing we want to talk about is being patient with yourself and others. We're all in this together. We're adapting. We're making changes. Changes take time. As Marvin said, nobody likes changes. We need to set realistic expectations for ourselves, for our patrons, and for our staff. Another thing we're going to adapt to are new relationship dynamics amongst our staff. And what if we don't all agree? One of the things we talk about, again, is self-awareness. How do we manage our own self-care and our own stress levels? We talked about mindfulness. We talked about breathing. Think long-term. You've known a lot of the staff at the library for a year, for a month, for a week. It doesn't matter. Let your encounters be relationship-driven. How you interact with your staff will affect your relationships. And again, remember, we're all in this together. Reflective listening. Marvin's going to talk about how we use reflective listening, and we need to validate the emotions of others, other staff members, your coworkers, and your patrons. And don't take things personally. This is a very hard thing to do, especially during this time. Refer to your workplace guidelines that will and should be in place, and refer to them rather than have your own personal opinions.
So in all of this and everything that we're doing and how we're, talking about interacting with others, communication is essential. So a lot of this comes down to the way you communicate. The way you talk, move, and gesture can influence your encounter. So it's really, again, about self-awareness. It's having an awareness of the way we communicate is really going to help those encounters. So self-awareness of the verbal and the nonverbal communication is even more crucial when you and the person you are communicating with are under stress. So as I'm sure you've experienced, when you're under stress or when someone else is under stress, you can be more reactive, you can take things more personally. So you need to work even harder to respond rather than to, just react in the moment. We also want to remind you that people who are living with mental illness may be even more sensitive to these cues, just as a reminder when you're having encounters with people. The types of communication. So there's verbal communication and nonverbal. Some of the components of verbal communication, volume. Sometimes when we're talking to someone and things are escalating, we may take care to just, lower the volume if we speak a little softer, or our pace if we speak slower. Someone may also match that. We want to be aware of how we're using our language, the type of inflection in our voice, or humor, sarcasm, heated encounters, or even just talking to someone who you don't know very well. Humor and sarcasm is probably not indicated because everyone takes it a little bit differently. Nonverbal, and I think that, I was thinking about this, the nonverbal is really interesting right now because with people wearing masks, you can't see facial expression. And that has made communication so much more difficult, I find. I find that it's a very new experience to be talking to people and not being able to see their facial expression. So we have to rely on the verbal and maybe some other body language. Of course, we can't get too close to someone now, too, because of social distancing, and that's another aspect of the nonverbal. So we're not going to have too much issue with people touching each other or getting too close, hopefully. But these are just all things to be aware of.
And just to underscore, what Emily was just saying about the nonverbal is there's something called the 7% rule. And the 7% rule is basically saying that really only 7% of our communication is verbal, but 93% is nonverbal, so that people really are impacted much more by body language and your tone of voice than by the actual words that you're saying. So to sort of repeat what Emily was saying about now during the time when we're wearing a mask, that in itself adds to our stress, and it's like a disruption in our connection, and it's a disruption in our ability to connect and to communicate effectively. So that's another reason to really be patient and slow down and be intentional, and just really give one another the benefit of the doubt when we can.
So reflective listening is a tool that could be used by you, by everybody, and you can use it with employees, with patrons, on the home front, and it's basically a different way of listening and responding, maybe different than what we're used to. It's a difference between listening to understand rather than listening to respond and reply. So let's take an example, for instance. As a library director, you may be approached by one of your employees. Let's call her Doris, and say Doris comes into your office and says to you, I don't know if I can do this. I don't know if I could really work here anymore with all of this. I just don't know. Now, I might say, if I'm not using reflective listening, I might say, why, Doris, you've been here for 20 years. Of course you could do this. It's just a change. It's another change. You'll be fine. And that's one example of not reflective listening. Well, let's now play this again. Okay, so Doris comes into the office and says, I can't do this anymore. I don't know if I could work here anymore. Reflective listening would first kind of make sure that you're hearing okay. So Doris, you're saying that you're really questioning your ability to work here. Right? That's rephrasing it, paraphrasing it would be sort of step number one. And she goes, yeah, I don't know, I can't take this anymore. And the next step would be sort of like also listening for the underlying emotion, making sure that, so Doris, so what I'm hearing is that you're really questioning your ability to change now. You're really not sure whether or not this is going to something that you're able to kind of do at this particular time. And of course, Doris is going to then say, yeah, I am questioning that. And then we have a conversation that goes on, but it's a different sense. You're no longer just answering it on the topical level. You're actually listening for the underlying fear. So it sounds like, Doris, you might be kind of anxious about all these changes and stuff. And Doris says, yeah, listen, I'm immune compromised. I don't want to catch this COVID stuff. This is serious stuff. I can understand. It sounds to me that you're worried about that you're worried about your own personal safety. You're worried about whether or not we put in the changes, that are necessary to keep you safe. See, that's more of the reflective part of the listening part, the part where you're actually not just responding, but slowing it down and thinking anytime somebody comes in. And whether this could be a patron or not, you're going to be thinking, what is the underlying issue here, and how can I address it? Am I hearing them correctly? Now, this is not something that today you can kind of go home and sort of be an expert in reflective or active listening, but it is something to sort of practice, and you practice by just paraphrasing somebody, what they say, making sure that you're listening to them, and then just trying to sort of reflect the sort of feelings that are underneath and stuff. And so, that's ultimately how it works, and it works wonderful because at the end of this conversation, if you're doing reflective listening, And Doris is still going to be anxious. She's still going to have concerns. But the difference is Doris is going to walk away from that encounter with you feeling like at least you understand. You have heard her. You have heard her fears and her underlying concern and stuff. Not just said, hey, Doris, you've been with us for a long time, so, you can continue to do this. So it's more of a qualitative, and it's not instinctive, because normally we really have to stop and think about it, and that's really what we're asking sort of you to think about when someone is really talking to you. What, in your brain, it's like, what are they really trying to say? That's the key. And of course, when somebody feels validated, when you give somebody validation, that's an important part of making them feel heard, feeling better, feeling less stressed. And that's an important part. It's soothing for someone to hear. Boy, Doris might go to her coworker and say, I just talked to the boss, and he seemed to understand what was going on. But let me give you something else about validation. Have you ever been on a customer service line? And we've all sort of called this, and we go into this queue, and you hear this wonderful music that drives you crazy after 20 minutes. Well, I was on this line, and I was thinking, gee, when are they ever going to get to me? When am I going to get to an operator? And then all of a sudden, the recording stopped, and someone said, you are number 5. It will be 10 more minutes approximately. So, new information. That information is invaluable for me, because then it helped me process this new information and say, wait a second, I can wait this. I can understand what's going on. If you're waiting in line, if you're waiting at a doctor's office, if you're waiting to get into a building and you're getting constant new information, say, for instance, the building is at capacity and there's a line now outside. When was there ever a line to get into a library? And you have to tell somebody that they have to wait. Well, if the person is waiting there for 10 minutes, 5 minutes, it's going to feel like an eternity to them. And so just having someone to go out and say, this is really hard. I know it's hard for you to wait. We think that it'll, another 5 minutes and things will be okay. You can enter the building. Just that information validates that they've been waiting, that they're anxious, that they're impatient, and that really plays a tremendous part in de-escalating something before it gets out of control. The more information people can process, hey, we're all in this together. We're all working on this together. We understand it's difficult to wait online. We understand that there's a line for processing now because we're going slower, because there's less ability to check out. We don't have independent kiosks yet. Whatever the issue is, the more information as a director you could do that, the better able to sort of de-escalate any potential issues. And that's what validation is really all about.
Now that we've heard about validation, reflective listening, and all these wonderful tools that we've just talked to you about, now we're going to actually talk about de-escalating and how to respond when a patron refuses to follow the guidelines. And this could go to the question in the chat of what should we do when someone won't wear a mask? You want to be empathetic and non-judgmental. You want to respect the person's space. Obviously, with social distancing, we're not going to be getting close to people, but you really want to stay away from them. Use the non-threatening body language, which is keeping your hands down, kind of using a neutral tone of voice, and try not to overreact. You're focusing on the person's feelings. Marvin just talked about validation, using reflective listening and supportive language. We hear what you're saying. We understand that you're not happy with the rules. Redirect challenging questions back to the main issue. So if someone doesn't want to wear a mask, instead of going off into all these other things, you want to come back to them not wearing a mask, validating their feelings about not wearing a mask. You want to keep it simple. You want to restate the rules. I'm sure that the library may or may not have the rules posted, but you always want to go back to what the rules of the library are. And then something else to keep in mind, that you want to allow silence. Sometimes just being silent for a moment or two, taking a pause, can cool things down. Now, a lot of these encounters will take seconds, or they may take a minute or two. A lot to process for us as directors, for our patrons, and our coworkers. So what we want to do is a little bit of a role play right now to kind of give you an idea of how a conversation could go.
Okay. So I guess I'm going to be a staff, and Linda is going to be the director, and Marvin is going to be a patron. So, you know, I'm go ahead. Do you want to start it out?
Good morning. Okay, so I'm coming into the library.
Good morning, sir. I see that you're not wearing a mask, and I'm sorry to tell you, but you can't come in.
No. This is not. That's not going to work here. This is a free country. This does not work. I'm not wearing a mask. I have a right not to wear a mask.
Sir,
it says so.
Okay, sir. You can see I'm wearing a mask, and I have to ask you to leave because the rule is.
This is a bunch of baloney. It's in the Constitution. I have a card in my wallet signed by the federal government that tells me that I don't have to wear a mask.
Sir, I'll be right back. Go over to the director. Linda, I really need your help. We've got, this is our
Where are you going?
This is our first patron, and I just really, I can't deal with this. I need your help.
Okay.
COVID thing
Let's go over here together and address the situation. Sir,
it's a conspiracy. Yes. I don't want to wear a mask. I don't think I have to wear a mask to come into the library. I never used to have to wear one before. I don't understand.
I understand that you never had to wear a mask before. I hear what you're saying. It's really disturbing to have to change. Unfortunately, there are some new rules now that are here at the library to protect not only your safety, but the safety of all the patrons. And while you really don't want to wear a mask, if you're going to patronize the library, we really ask for now that you cooperate and follow the rules that have been set up.
Where are the rules? Where are these rules? I don't see these rules. Where are they?
The rules are posted. If not, I could get you a copy of the rules. These rules are set up by the library and the state and the federal guidelines.
A bunch of nonsense. So in other words, I can't. You're saying I can't come into the library?
Unfortunately, at this specific time, if you don't follow the rules, you will not be allowed to patronize the library.
Okay.
So maybe we want to step out of this and just what we're attempting to illustrate is first, being judgmental or abruptly talking to a patron and pointing to the rules. So I'm doing what I think is the right thing. I'm telling him, these are the rules. But the extra, and then, when I had trouble, I wanted to go to my director and get a little backup, get a little help. So Linda, some of the things that she said is she's validating, I can see that you're upset. I see you feel strongly. I see that life has changed. So having that extra piece of validation is really what we're emphasizing. And I would say, I think, Linda was using a bit of a calmer tone, a bit softer, slower. I was a little more abrupt, harsh. So that's just a little mini illustration of what we're trying to address, some of the questions that you may have. Do we want to ask if there's any thoughts? I know we have a little bit of time. So if anybody wants to utilize chat to, what are your thoughts about that kind of interaction? Is the information that we're sharing with you, does it feel clear? Is it something that you've heard before? Do you feel like, oh man, I do reflective listening all the time, this is nothing new? Or is it, are there any other situations that you might want to role play, or any other questions here?
Well, while they're thinking about that, keep in mind that if I, as a patron, got angry and began to escalate and speak louder and got more agitated, that the way would be to counter that energy. So I would expect Linda to be able to talk softer and balance out the energy, so that I have to basically, I can't be shouting at her and not listen if I want to listen to her, and I might have to lean in more to be able to hear it. So a de-escalation technique, as Emily had mentioned quickly before, was that you sort of go down. If someone goes high agitation, you're going to remain very calm, very relaxed, and actually talk lower and lower and stuff. And then eventually what we do here in the Mental Health Association is we actually start walking. I actually start a conversation with someone who might be in the lobby that's agitated, that doesn't want to follow the rules or is intoxicated, and I'll walk with them as they're listening to me or as I am listening, because if they're talking to me, I say, come on, I'm walking. And where am I walking to? I'm walking out the door. I'm walking to the exit. So it's easier to have a discussion closer to the exit than it is smack in the middle of the, Grand Central, right? Smack in the middle of the library or the agency, et cetera. So just remember, de-escalation sometimes is a question of balancing out the amplitude of your voice in terms, and slowing down the cadence, because when people get agitated, they can't process new information.
Okay.
So we do have something in the chat now. Someone said, I thought the patron backed down too quickly. Some patrons are more tenacious, even with attempted de-escalation, which is sort of where Marvin was going. He was still, yes, but
true. That's very true.
That's true. Yeah. So sometimes you're really going to be in that place for a while, continuing to do what Linda was doing, and as Marvin was saying, also maybe even starting to employ some other tactics too, and even starting to walk the patron out if things just really aren't, de-escalating.
Right. Right. And not taking things personally is an important part. If I lose, well, not me as the patron, if the director loses control of their own and starts to get tense and starts shouting, then the whole thing goes down the tubes pretty quickly.
Right. And then I see in the chat another follow-up comment that this is validating and also a good reminder to keep emotions in check when communicating with patrons who are upset. And then there you kind of see, why we're in the beginning, we're talking a lot about checking in with yourself, the self-awareness, the using the mindfulness. These are the moments where patience is needed, where you give yourself the chance to stop and take a breath. It can be very important. It can really influence the outcome of any particular encounter.
Right.
And, in a sense, I think that's also what we're saying here in this slide, that as library directors, your response is so important, not only for the health and safety of your workforce, but it will impact how well or how poorly your staff respond, which will impact their morale as well as the quality of services and overall experience for the patron. And that's why we've kind of started with as Renee was saying, your own awareness of how you're responding and how you're feeling. And then, it has a sort of, from the top down kind of effect. If you're aware of that, and then based on that, you can make, clear decisions, make everything clear and transparent for your staff, and remain available just the way, as much as is possible, but just the way Linda was available to Renee when she needed to go to her director and get a little bit of support. I think, more than ever, we all need that from our directors, to be able to go and check in and get some reassurance and some assistance.
Mm-hmm. Yes, and so we have a few final thoughts to share, and to just remember that we are all going through extraordinary stress. We're all experiencing different levels of uncertainty, fear, anxiety, reactions to change. Different people have been affected more severely by the coronavirus. There are some among you who may have been sick with coronavirus, or had a loved one with coronavirus, or maybe even lost someone to coronavirus. So just to keep that in mind, that this is really a time for empathy, and to moderate your expectations of yourself and your staff right now. again, a reminder, devote energy to things that are within your control rather than stressing over what's not in your control. You can never go wrong by being supportive with one another, empathic and reflective, even if it takes more than one attempt. Like with that tenacious patron, you may have to go back a few times. You may need to take, longer minutes. It may not be something that you can just take care of right away. So just take that long-term perspective with one another, having a long-term relationship-focused perspective rather than focusing just on one conversation or one encounter. Think about the long term, because we will get through this. We don't know what things will look like in a month from now, 6 months from now, a year from now, but we know that it will be different. Things are changing. So we want to kind of get through that. This is not a sprint by any means. It is a marathon. Take time for self-care, because when you are at your best, you have a much more increased capacity to cope with whatever changes are coming your way. I'd like to invite any of you, it's about 2:15, I'd like to invite any of you, if you have final thoughts or summarizing thoughts about what you heard or things that came up for you while we were talking that you may even want to share with one another, that things that we overlooked that you think might be helpful. Now is the time to light up the chat and light up the Q&A.
So while some of you are doing that, and most of you aren't, I'm going to tell you about the questions. It's just that who we are. Again, we are the Mental Health Association of Essex and Morris, and my name is Marvin, and there's Renee and Emily's contact information. So if there are questions that happen at any time from today on, it's a free resource just to pick up a phone and to call me and to call Renee and just say, hey, I have a question. I'm concerned about an employee, or I'm concerned about some questions about any kind of mental health or overstress. And that's what we're here for. It doesn't cost anything. That's what we're here. It's a community service. So feel free to kind of reach out. It's tough to kind of take all of this information and just try to get the actual meat of it and get enough meat on the bone in an hour and 15 minutes to kind of make you feel that this is worthwhile. But we try to put it together, and a lot of these things could be its own presentation. Communication in itself could be its own presentation, et cetera, as well as all of the kind of particular changes that the library are going through. So thank you for your attendance. We're going to stick around. If anybody needs to go, that's fine. We're here at least until another 5 to 10 minutes to see if there's any issues come up. And if not, I just want to wish you good luck in your opening day and stuff. I say break a leg, but that doesn't sound right in terms of that. So thank you.
Thanks, everybody.
Thank you.
Thank you.
Thank you.
And someone just continue to monitor the chat for a few minutes, and if not, then we'll know that
sounds like
people are gone.
Sounds like there were a lot of thank yous coming in.
Okay.
Thank you, everybody. And then here's a few references that we popped up, and we can make a PDF of the presentation available to people if it's useful to you. Okay.
Okay. Yeah.
Thanks.
Great.
Maybe we'll rely on our host, Eric, to sort of let us know.
He's watching people disappear now.
Yeah, we're down to 13 people. A lot of thank yous coming through. A lot of people, yeah. Thank you for everything. Thank you very much. Yep.
Okay.
You're most welcome.
All right, then I guess we're good then if no other issues are coming up. Eric, our personal thanks to you again for making this go very smoothly.
Yeah.